Welcome back. I'm Shurland Mayers. Today is our final session of Black Health and Wellness 2022. Although our time with you has come to an end, we couldn't end with some final last words and music by the singing pastors of Piscataway. Their mission to spread the love of Jesus and witness His saving grace through the testimony of which is music. Just wait. You'll hear precious memories. And hold on. So here's to you on health and wellness. Let's get started.
Just memory how they flood my soul, ooh, in the stillness of a midnight and prayer sees unfold I'm just a country boy down in the hills of North Carolina. And every Sunday morning we would have to walk to church. But when we would get there, they would be singing a song, and in this song there was a saint that used to sing a verse. And Willie, I want you to help me to sing this verse. Take your time and sing, Willie.
Set our
when I'm lonely, the truth, the real truth of Jesus, love is shown. Take your time, Willie. Take your time, Willie. When I'm lonely, Jesus just whispers. He lets me know that I'm with you. And precious Lord, precious Savior, tell them about Jesus. Won't He do it? Lord, won't He do it? Lord, He frees me. Precious memory in the stillness of a midnight prayer, just say prayer. Please unfold, yes, yes.
I'm Carol Taylor, and we are excited to continue with our theme this year, Black Health and Wellness. Today, we have a special guest in the area of eye care. Our keynote speaker is Dr. Corbin Simon, optometrist physician. Let me tell you something about the quality of this exceptional person. Her primary goal is to provide a personal eye care experience that focuses on eye health. Dr. Corbin Simon invests in the state-of-the-art technology to provide exceptional quality eye care. Dr. Corbin Simon is passionate about optometry and eye health and provides patients of all ages with expert eye care. At In Focus Vision Center and Eye Care on Centennial Avenue in Piscataway, New Jersey, Dr. Corbin Simon has over 27 years of experience and delivers services ranging from comprehensive eye exams and prescriptions for eyeglasses and contact lenses to diagnose and treating conditions including dry eye, cataracts, glaucoma, and diabetes-related eye problems. Dr. Corbin Simon earned her doctorate of optometry degree at the State University of New York College of Optometry in New York City. She went on to serve as an assistant clinical professor for 8 years. She was also the chief of eye service at the East New York Diagnostic and Treatment Center and was on staff at several other hospitals in New York before moving to New Jersey in 2002. Dr. Corbin Simon was a former president and vice president of the New Jersey Society of Optometric Physicians. Outside of work, Dr. Corbin Simon enjoys theater, sports, traveling with her husband and 2 sons. She formerly mentored female students at Claire Barton High School in Brooklyn for the Women in Government programs. Dr. Corbin provides state-of-the-art technology. Please welcome our keynote speaker, Dr. Corbin Simon.
Hello, everyone, and thank you, Ms. Carol Taylor, for that kind introduction. And, Carol was one of my first patients when I actually opened up my practice here in Piscataway, so I appreciate that. Well, again, hello, everyone. It's truly an honor to speak with you today to discuss issues that are paramount importance to me regarding health and wellness, particularly within the Black community. My hope is to shed some insight regarding the health issues that plague our communities, along with some prescriptions we can employ to help mitigate the severity of the many of these ongoing health issues. Over the past 2 years, we have witnessed the disproportionate impact the COVID-19 pandemic has had on communities of color. The question is, how did we get here? And how do we remedy this gap? Our challenge is to eradicate the causes that are the key reasons for these disparities. Racism, poverty, poor education, poor nutrition, and environmental exposures are major contributing factors. Oftentimes, it has been said that the eyes are the windows to the soul. In my 27 years as a practicing optometric physician, I can assure you this statement is not only true with respect to emotions and sometimes thoughts, but with respect to an individual's physical health and wealth. I have always practiced with a comprehensive, holistic approach when serving and treating my patients. Having conducted countless eye examinations over the decades has allowed me to provide an early diagnosis for some potential life-threatening conditions, in addition to counseling patients on their management of diabetes, hypertension, and glaucoma, which affects our communities at a higher rate. Let's start off with some encouraging news. According to the CDC, there have been a 25% decline in the death rate for Black Americans over the past 17 years for those aged 65 and older. However, according to the U.S. Census Bureau, the death rate for Black Americans is generally higher than white Americans for heart diseases, strokes, cancer, asthma, influenza and pneumonia, diabetes, HIV/AIDS, and homicide. It is especially alarming that new analysis is showing that younger Black Americans are living with or dying of many conditions typically found in white Americans at older ages. The difference shows up in Black Americans in their 20s, 30s, and 40s for chronic diseases that are not caught early or undetectable. When diseases start early, they can lead to death early. Smoking, obesity rates among Blacks Americans only exacerbate this already frightening health crisis. And we know health differences are often due to economic and social conditions that are more common among Black Americans than white Americans. For example, Black American adults are more likely to report they cannot see a doctor because of costs or they lack access to a physician in their neighborhood. The sad reality has another terrible effect. It leads to too much higher healthcare costs due to the number of Black patients being forced to use emergency rooms as their only line of treatment. And we know that emergency rooms provide the most extensive health care. But if that person had a routine preventative health examination, this would be the more cost-effective and more likely way to detect serious health issues in a very early stage. The Patient Protection and Affordable Care Act, signed by President Obama in March of 2010, was to create better access to affordable health care for all Americans. I am sure you will agree that all Americans should have equal opportunities and access to pursue a healthy lifestyle. The advent of COVID-19 and its variants has further compounded these already disturbing trends by relentlessly preying on immune-compromised individuals and those with underlying health conditions. The cyclical waves of emergency rooms being at or near capacity during the pandemic, coupled with accepted myths dispelling the veracity of the science behind the need for vaccinations and booster shots, are key ingredients in a recipe for a health and wellness calamity for far too many in Black communities in the United States. Another health concern in our communities are toxic environmental exposure. A Princeton University study explored the environmental hazards that disproportionately affect our communities in areas that are heavily populated. Air pollution in these communities affect more than 1 million Black Americans within a half-mile of natural gas facilities. Methane gas and other toxic chemicals released in the atmosphere lead to cancer risk due to poor air quality. The studies show that approximately 13.4% of Black children suffer from asthma as compared to 7.3% of white children. As noted by Biomedical Central in the article titled, "Improving the Health of African Americans in the USA, an Overdue Opportunity for Social Justice," access to healthy food is also a frequent problem in poor African American communities. Food deserts describe neighborhoods without easy access to supermarkets that sell fresh produce and other healthy foods. Black neighborhoods has significantly fewer supermarkets than white ones. Several studies also document that the food that's available in poor Black neighborhoods is less fresh and of lower quality. In contrast, alcohol outlets are much more numerous in Black neighborhoods. It is not surprising that rates of obesity and diabetes are highest in poor Black neighborhoods. According to the VCU Center on Society and Health's article on why education matters to health, families with higher incomes are more easily purchase healthy foods, have time to exercise regularly, and pay for health services and transportation. A goal to address nationwide health promotion and disease prevention was an objective of the Healthy People 2010 initiative by the Department of Health and Human Resources. However, this project was not successful in mitigating the health disparities affecting the Black community. The strategies proposed by many groups often do not address the underlying issues of social racism, poor education, physician bias, and many other factors that plague our communities. We must approach this dire need for better, affordable, and quality health care and wellness in our communities holistically. Creating a team of community leaders, politicians, faith leaders, physicians, and teachers are all necessary to develop critical programs that can be implemented to meet the challenge. I would like to offer some thoughts of my own that challenge our communities to live healthier lives. The basic prescription for health and wellness is still the same. Drink plenty of water every day. For example, if you weigh 150 pounds, it's recommended to drink at least 100 ounces of water daily according to WebMD. Drink more if you're physically active or sweating or on hot days. And remember to replenish with electrolytes. Maintain a healthy balance. Healthy diet consisting mainly of fruits and vegetables. Darker green vegetables such as kale, spinach, collard greens, and without the ham hocks. Limiting or possibly eliminating pork and red meat from your diet, using fish or seafood, poultry or vegetarian dishes as substitutes. Maintaining a healthy weight as recommended by your doctor. Scheduling an annual physical exam with your primary physician. You need to stay current with recommended health screenings such as prostate exams, mammograms, colonoscopies, and your eye exams. Limiting your daily intake of processed sugars and salt, especially sodium. Sugar is one of the major reasons for chronic inflammatory diseases that can lead to diabetes and hypertension. Reading the nutrition labels on foods and drinks that you purchase, particularly paying attention to the amount of total fats, total carbohydrates, sodium, and cholesterol. For example, some canned foods and frozen foods can have a very high level of sodium. Understanding the meaning of serving size of the nutrition label. If the serving size for 12 pieces of candy is 140 calories, and there are 5 servings in a bag, then consuming a whole bag of candy will be equal to 700 calories. I don't think you want to do that. Eliminating processed foods. Instead, eat foods that can be grown or from animal life. Offer modified recipes to popular foods that reduces sugar, salts, and fats. Develop a routine exercise, right? A program after consulting your physician, a brisk walk, light weights, or your favorite sport. On a weekly basis, I play tennis every week. I do strength training 3 times a week, okay? So you can get out there and do the same. The other thing is to create early outreach programs for young Black kids to engage in learning more about math and science that encourages them to pursue a career in medicine. We need more people in the profession that look like us, okay? So we can speak to our own communities about health and wellness. So one of the things I want to stress here that I think many people don't know about is how to talk to your doctor. I find that when many people come into my office and I ask questions, right, they don't know the answers to their basic questions. Okay, you see your doctor every 3 months, you have your diabetic check, you have your hemoglobin A1C check. What is that number? And most people don't know what that number is. You can't manage a condition if you don't know how you're doing and how you're feeling based on those numbers. So it's important to know that. So I challenge you to do this. Create a category on your phone in the notes section or the reminder section of your app. Entitle it Physician Exam, question for the doctors, right? You can also do this if you're going for your GYN visit, your eye exam, or your dental visit, right? Create that so when you come up with a question that you feel, oh, I need to ask the doctor that question, go right into that app, jot it down, so that when you're sitting there in the exam room with your doctor, you can actually go back to that and look it over and say, hey, doc, can you answer this question for me, okay? Also in there for my diabetic patients especially, know your hemoglobin A1C and know how it's affecting you. That's critical and that's important. Modify your meals. Instead of cereal in the morning, have oatmeal with a protein, either almond butter or peanut butter. Vegetable omelets, protein smoothies with vegetables. Add a little bit of cinnamon to your morning beverage to help control your sugar level. Put lemon in your water. Reduce or eliminate pasta from your diet. Switch from white rice to wild or brown rice. Bake a sweet potato and add cinnamon without the sugar. Bake your chicken instead of frying. Add more vegetables to your plate. I can't stress enough the importance of this for us to get on the opposite side of this, for us to learn new strategies in our dietary changes that we need to make to help us have healthier lifestyles, okay? It's nice to see that the numbers are changing, but we have to continue on that trajectory, you know? And it's important for us to know what are the tools and things that we need to do. So I challenge you to do this. You know, get a group together if you feel that you can't do this alone. Start within your communities, okay? Help each other, share recipes, okay? These are all important things that you can do to help yourself in this challenge, all right? Don't just make it a resolution. Make it a lifestyle, okay? Make it a wellness lifestyle, all right? I want to wish you all the best for 2022. I want to wish you good health and success in the future.
We thank you for joining us in our Black History celebration. A very special thanks to Diana Motley, our Black History Chair, her backup, Jeanette Bovell, committee members, Carol Taylor, Eloise Robinson, Lois Green, Brenda Smith, and Barbara George. Also, I want to thank the entire Piscataway African American Seniors Club members who continue to be faithful to meet and support the group as we navigate through this pandemic. We also thank the staff at Piscataway Community TV in working with us for their diligence and patience. Thank you.
Hold on, hold on, hold on. Willie, can you help me sing? Hold on, hold on, hold on. I want you to know that it will be all right. If you really believe that, come on and clap your hands with us now. Yeah. Yeah, yeah, yeah. Listen, hold on, it'll be all right. Joy comes, yes it does. All you gotta do is hold on, yeah. I promise you that. Say that again, hold on, it'll be all right. Joy comes. it does. Said all you gotta do is hold on, y'all. Promise you that we'll be alright. Listen here, see there are times when you have to cry, yeah. And there are times when you wanna ask why, but don't let go of his unchanging hand. I guarantee, I promise you, he'll be there on time. Hold on, yeah. I guarantee that, yes it does. See, all you gotta do is hold on, y'all. I promise you that. Let me say this here. I asked the Lord, why so much pain? Burdens we don't have to bear if we call on his name. So here's what I do before I lay down at night. I pray to him and he tells me it'll be alright. Hold on, yeah. I guarantee that joy comes, yes it does. I wish I had a witness. Hold on, y'all. I promise you that. Stay right there. Hold on. Hold on. Hold on. Hold on. Is there anybody here holding on? I know it's hard. Hard sometimes. Anybody know he can make a way out of no way? Here's what I'ma do, y'all. I'm holding on. I'm holding on. I'ma hold on to the day that he comes. Said I'm holding on. I'm holding on. Said I'm holding on. I'ma hold on. And don't worry, cause I know it'll be. Said don't worry, y'all, cause I know it'll be. Y'all out here worried, I guarantee, if you give it to the Lord, he'll make it alright. I know that it will be alright. I know it will be.